these will be combined into one package that can be sent to President Obama for his signature. What do these bills have in common? One thing they have in common is the mandate that everybody has to have an insurance policy. Well, they have to be covered by Medicare, or get their care through Medicare, or have their employer cover them, or be poor enough that they're on Medicaid. If they don't qualify for any of these coverages, then they have to go out and buy a policy. And recognizing that they might not be able to afford that, there will be subsidies to help pay the premiums for these. And this is going to be a very complicated thing. And the Congressional Budget Organization, when they tried to figure out what these plans would cost, they said that with the Kennedy bill, it would be $1 trillion, the base expense, but they hadn't even begun to calculate what would it cost to do all this administrative stuff. That's going to be out of sight. However, where did this subsidy and mandates plan come from? Back last November, when we were all celebrating Barack Obama's election, the insurance people were applying. And midway through November, the Blue Cross Association, the National Blue Cross Association, and also the Association of the big insurance companies, the American Health Insurance Plans, came up with announcements that they would commit that their members would not do all the bad things that people have been charging the insurance companies with doing. And they wouldn't reject people because of preconditions, and they wouldn't discriminate, and so on. But they said that before they could make that commitment, the government would have to make a commitment to require everybody to be covered. And then the government would have to commit to subsidize the premiums so that those people could afford to buy these policies. Well, gee whiz, here's the government handing over 50 million new customers to the insurance companies to pad those profits that I just cited. And then the government would be paying money to help people buy these policies. Now, I find this whole concept offensive. I think that the whole thing is really a slander on the American people. It says that we're such deadbeats that we won't take care of our own health unless we're compelled to it on the penalty of tax hits and excise taxes and things like that. I think that's really kind of scurrilous. And Bobby Scott raised the question of, are we talking about health care as a privilege or as a right? I think everybody would agree here, and President Obama has said it's a right. Well, it's a damn funny right if you're going to be forced to exercise it. And, well, the next thing is this public option. And as I hear this debate going on about the public option, I get the feeling that we're all being sort of shunted onto a dead-end siding with public option over the sign, where we can have a big fight and raise a lot of hell and so on and get all exercised over something that is really secondary to the basic question and is probably not going to be decided in a sensible way. Now, Bobby Scott has talked about the public option that his associates in the House would like to see. That would be a single-payer plan, which would actually provide care to people. What's actually being talked about in the public option is another insurance plan, which, as President Obama said, would have the objective of keeping the insurance companies honest. Well, I don't think that we ought to design any part of our system with the purpose of keeping a bunch of scam artists honest. Now, one of the things that goes on with this public option is the conservatives and the Republicans oppose it terribly. But they've insisted that it has to be a level playing field. I mean, they don't like it under any circumstances, but there's this talk of the level playing field, which would be, in effect, tying the hands of this public option program so that it would not be a real competitor of the insurance companies. Now, the House committee talks about a public option. The other committees, the Baucus's committee hasn't even got to it yet. They haven't proposed any specific legislation. They're just talking concepts still, at least publicly. And the Kennedy committee said that when they put out their proposed bill, they just said that the public option is under discussion. The House committees did put a public option in there. And they said that, let's see, ensuring a level playing field. This is taken from the text of the legislation that they put forth. Actually, it's a discussion draft, they call it, of the legislation. So it's consistent with this subtitle, the public health insurance option shall comply with requirements that are applicable under this title to an exchange participating health benefits plan. They have to comply with all the requirements of the private insurers, including requirements related to benefits, benefit levels, provider networks, notices, consumer protections, and cost sharing. That's pretty much it. I mean, they got to operate just like the private companies. So how are they going to keep the private companies honest? I don't think it's going to happen. And this is the kind of thing that is going on with this with these various legislations. So the question comes up, do we go for single payer and say, this is what we need, this is the best thing, let's keep that flag up at the top of the mast? Or do we compromise and say, well, if we get some kind of a public option, that'll be okay? What I'm afraid of is that we will get some kind of half-assed public option. We will get a totally complicated and almost unworkable system of mandates and subsidies, and nothing will get better. It may very well get worse. And this will be, if it's enacted, this will be hanging around the neck of the Democratic Party and indeed President Obama for as long as they're in office. And I don't think this is a very good outcome.